Yeah, good morning. This is Vinay from Kavi Solutions. I am with my colleagues to conduct the vendor information session today. And this is regarding like we are accepting requests for proposals for our electronic health record applications for our suppliers. Next slide, please. So the agenda will be will introducing our company and what's the problem and the solution components and how we'll be accepting our request for proposals. Next slide, please. So let me introduce our company. Our company is trying to deliver high quality, innovative, computerized healthcare management solutions. So particularly, we work in the area of health records to vendors. We aim at improving healthcare efficiency and productivity. Next, please. So the purpose of today's session is like there is a problem in the healthcare industry that physicians have been working on paper till now, so which is a very time-consuming process and which can affect their workflow. So we are trying to digitize this process of health records in order to improve the efficiency of healthcare delivery, and we will be finding looking for electronic health applications in the software area. So by these applications, we aim at using a friendly interface, and it meets the programming needs, and it is feasible for the physicians, and it can meet the data set protections. Next, please. So our client group or the opportunities we are currently having is like we deliver our solutions to the hospitals, emergency units, long-term care facilities, and doctor offices. Mm, and we are accepting the request for proposals, and we are looking for certain key components in our request for proposals. So first we are looking for what on a vendor part your requirements are. We'd like to know that, and we would like to have a specific format which you need to submit your request, and we want to know about more about your organization, what are your staff and the qualifications, and what are your delivery requirements, and what is the time frame you need required to deliver the solution to us, and what technical requirements like the software or devices or the area or the space you need. And we would like to know about your past projects and how can you meet the success criteria, where you can label us in a tabular form. And the functional requirements and other parts will be delivered by my colleague Aiden. She'll walk through the rest of the presentation. Aiden, you can start now.
Okay, good morning, guys. Thank you, Vinay. So I'm going to be talking about the functional requirements. We want an EHR to have all these functional components, such as demographic, patient, medical, and social history. EHR must be able to assist our medical staff with administration and physician note-taking. We take our patient privacy and security very seriously. The system must support the HIPAA standards for electronic transactions to avoid any attempt of breach. So our functional requirements must have is secure login, validate credentials, data entry, social history, data entry, taking, privacy and security standards. And we would also, it's not mandatory, but we'd also like a colored interface and a communication aspect such as messaging portal. And now Kiri is going to take over for vendor requirements.
Thank you so much, Aiden. So I have to say that the vendor requirement is actually one of the crucial aspects of a requested proposal. This is where the understanding the significance of partnering with the vendor and knowing the expected outcomes will aid in maintaining a mutually beneficial and collaborative relationship. Next slide, please. Now, with regard to the vendor requirement, here is the list. It includes a software as a service agreement, software safety non-disclosure agreement, cover all key performance indicators, quality assurance and testing, payment terms, training requirements, and at last, maintenance and support process. Next, we will have Yugal explain the evaluation criteria for us.
So as the title suggests, the proposals will be graded on specific criteria which are clearly mentioned in the RPF issued to all the vendors. Few tips that we can suggest are work smart and not hard. Stick to the criteria. All criteria are mentioned clearly. Some of the criteria have minimum requirements, so even if your company doesn't meet the minimum requirements, we suggest you to submit your proposal as we want to see your company's potential and the end product. So these are the criteria that we have issued to you guys, the mandatory requirements, minimum requirement, and the ratings accordingly. Now we'll have Q&A session. It'll be 5-minute session, so please be specific. We'll start now. Any questions?
Okay. Hello, Vinay.
Yes.
I'm Vinay, the manager from the Scarborough Health Network. I have a question for you. What exactly is the scope of the project?
Yeah, we are looking to expand our health records application. So we want to ease the workflow. So we are looking more of a user-based experience. We want to improve the user-based experience, and it has a lot of scope. Like we want to expand to another areas like complex care units or respiratory units, or we want to use in other facilities like long-term care. So the scope is very wide. We are looking at a broader perspective.
All right. Thank you so much.
Yeah, you're welcome.
Okay, next question, please.
Hi, my question is for Yugal. I'm from UHN, vendor from UHN, and I just want to get a clarification in regards to the work smart, not hard. What does that mean?
The specific criteria has been issued to you guys in RFP, so please work on those specific criteria and not do something else on your own, as it'll be off the record. So you can save time and focus on those criteria.
All right, and yeah, that's perfect. Thank you so much.
Next. Hi, I'm John. I have a question for Aiden. So what do you mean by hello? What do you mean by patient medical history and social history?
Okay, what I mean by that is medical history aspect would be the patient's medication list, any medical conditions that they have, and then social history is like occupational, maternal status, and how often they'll be, if they drink or smoke.
Oh, okay. Thank you.
No problem.
Next question, please.
Yeah, hi. I'm from Zen Solutions. Like anyone can answer this question. Like I'm looking for, like as you said, you're looking for any user-based application, right? So what specific user criteria are you looking for?
Hi, Zen. So what we're looking for exactly, that we must have a demo of the software to show our health team, as well as vendors should offer free test trial to test features, benefits, and usability. So with regards to your question on usability, we're looking for an end-to-end flow. At the same time, it should include all technical features that include confidential and proprietary information of the organization. I hope that answers your question.
Yeah, got it. Thank you. Thank you so much.
We are running short of time, so we'll just move on to next.
Okay, so we want to provide an efficient and we want to provide efficient and easy to use EHR system for our medical staff. We think by giving clinicians a significant chance to give contribution to choosing the EHR software, structuring EHR work processes, and arranging the implementation process, will allow them to have a full understanding of their system and less technical issue that they currently face.
Now we have a call to action, which is partnership and collaboration to achieve successful outcomes in the long run.
All right. Thank you so much for coming, everyone. Thank you and all the best.
Bye.
Yeah.
Bye. Thank you.